Hello, everyone, and welcome back to the Yappy Hour powered by Yappily. I'm your host, Nathan Dunleavy, and today we're talking about something that affects a huge number of dogs, often quietly and often earlier than most people realise, and that is arthritis. Many guardians think arthritis is simply a problem for older dogs, but the reality is it can begin much earlier and the signs can sometimes be subtle. Joining me today is Hannah Capon, founder of Canine Arthritis Management, also known as CAM. Hannah is a veterinary professional who has dedicated her work to helping guardians and professionals better understand, identify and support dogs living with arthritis. We're going to explore what arthritis actually is, how to spot the early signs, and most importantly, what guardians can do to help their dogs live comfortable, happy lives. If you share your life with a dog, especially a dog who seems to be slowing down, this is a conversation you don't want to miss. So grab a cup of tea, settle in, and let's get started. Hannah Capon, welcome to the Yappy Hour powered by Yappily. How are you doing?
I'm very good. I'm in the snow. I'm up in north of Toronto by about 2-3 hours, just having a little bit of a pain excursion.
Yeah, we were talking off air. Canada's on my list. I had an uncle that lived in Vancouver, and I want to do the Rocky Mountaineer through Banff. It looks amazing.
Oh, that's nice. That's lovely. But yeah, Canada's a big place, and I'm very lucky. Yeah, well, I've got friends from all over the world that are really fascinated in chronic pain, and they've got like a huge passion for it. So I'm on a little bit of a pain tour. I'm trying to see if Netflix would like me to just do a little documentary about it. I think that'd be really fun. Yeah, I think they loads of viewers.
Amazing. Yeah, definitely. Hannah,
I am joking, but if anybody from Netflix is listening and they think what a fantastic idea, just get in touch.
yeah, we'll plug that a bit, and we'll put all your links so they can get in touch with you. Hannah, for anyone meeting you for the first time, could you tell us a little bit about yourself and what you do, please?
So I'm a vet. I'm a proud first opinion practitioner. I've been qualified now for 24 years. I've worked around the place. I'm a bit of a rolling stone. So I've worked in big practices, small practices. I've done emergency work. I've done sole charge. I got interested in chronic pain and arthritis around about 2013 when I realized that it just didn't stack up in practice. We were very good at some areas of veterinary medicine, but we seemed to be really neglectful in others. And it felt very contradictory to be performing preventative medicine, so fleas, worms, vaccines, neutering, all this. But we seem to be not able to really do much for chronic pain, specifically arthritis. So I got a little bit intrigued and did a lot of further studying, not just through veterinary boards, but also through the allied professionals. And I think that's made me a really strong believer in that team approach, because I've learned some of the things that have changed my life most from people that aren't vets.
Mm-hmm.
I did a lot of further studying and then decided to set up something called Canine Arthritis Management, which it aims to provide not just education and teaching and up-to-date current advice, but also empathy and support, like psychosocial support to anybody involved in the chronic pain sector, be you a vet, be you an allied professional, be you a caregiver. And my ambitions with it is to create a kind of peripatetic service that supports vets around the world, knowing that they just don't have the time in clinic to offer all that is needed to actually really create good care plans.
Yeah, fascinating. I love that. And when you say allied professionals, just so our viewers and listeners, that's like your dog trainers, behaviourists, and other sort of people.
Yeah, so it's when you think about it, so there's about 24,000 practicing vets in the UK.
Wow.
And when you look at how many other professionals that are involved and networked with us, as you say, behaviourists, physiotherapists, hydrotherapists, massage therapists, dog trainers, pet sitters, kennel owners, pet shop owners, you guys swamp us like 100-fold. And I think we forget how important you are in that kind of whole ecosystem about that caregiver and that dog or that cat or that donkey, that horse, whatever. And so I'm a really strong believer that the allied professionals need to have more floor space, more airspace.
Mm. And I'd love it's a collaborative approach, isn't it, as well?
Yeah, for
And
sure.
if you're all on the same page, it's what's going to be better for the animal.
Yeah, that's their ambition. I think sadly humans have personalities and they have their own agendas. They have their own previous experiences and future ambitions. So working in a team can actually be really challenging. But I think that's what we should be trying to do.
Definitely. Was there anything that kind of sparked your passion for canine arthritis and pain management, Hannah?
Having that moment where you realize you'd seen thousands and thousands of animals suffering and you're just not really connected how they were suffering. So I think arthritis was the spark for me, and it is very frequent that you see an animal come in and they look stiff. I'm like, I hate that word. Oh, he's really stiff. I'm like, well, that probably means that he's painful. And if these patients haven't actually had attention to that concern for months, if not years, oh, he's just getting old, he's just getting stiff. And then when you think about that lived experience for that animal in our world and they can't do anything to change it, they're living in our environment, they're being handled in our way, they're doing the tasks that we ask them to do, all the whilst living with discomfort. It just triggered me, and I thought, right, we supposedly really care about our companion animals. We supposedly have their best interests at heart, but we seem to be really failing to listen to them and their needs. So that's what triggered it. And then it's snowballed. It's gone out of control, if we're really honest.
I love it because even like people I speak to, like I've had a physio with my dog and she knows all about you. So the message is spreading and
Yay!
everyone you speak to knows about Cam and Hannah. So
The English gobshite that just can't shut up about it. Yes, that's me.
it's the best way. Was there a particular like dog or moment that then led to the creation of Cam and Canine Arthritis Management?
Holly, my dog, certainly was a flagship and a very lived experience, but actually, no, it was a person. This is going to trigger a few people, so apologies if anybody has problems with the topic of suicide. I was working with a vet nurse. There was me, Dion, vet nurse, and my mate Nikki, and we were a trio. We had such a laugh at work.
Mm.
But Dion had a condition that left her with dysesthesia, which means that her somatosensory system, so her sensations from her skin were being misinterpreted by her brain as pain. So
Oh,
touch, temperature, anything like that. She often felt that her skin was on fire. The
oh
worst
gosh.
places being her face, her chest, her forearms.
Oh,
And I worked with her for a good year and a half, and then found she took her own life. So she died
oh
by
my,
suicide.
oh my
And
goodness.
she had stolen Eustatel from work, but the real crux of the story is that she stole it 6 months before she did it, because we could trace batch numbers. So for me, it was quite a profound moment to know that the person that I loved to bits, worked with, we had such a good time at work. In the back of her mind, she was always suffering. And I think that's why I feel a huge care towards that our animals are having lived experiences that we could never really understand, but depression, anxiety, fear. But they're in a home and they're getting fed and they go for walks. So people go, oh, they're having a great time, but are they? So yes, that was the real spark for me was, oh my God. Yeah.
What a journey and a legacy that she's left as well.
Yeah, yeah.
Amazing.
And I learned a lot from her because she'd come to work and she wouldn't demonstrate pain. And so you were hearing that she'd spent the evening semi-naked in a dark room, unable to drink or eat because her face felt like it was burning. So if she moved her cheeks, it felt like it was burning. She
Oh,
couldn't purse her lips together because it felt like it was burning.
oh
But
my
then she'd come
gosh.
to work and she'd do anesthetics and she'd handle animals. But that's because the brain is where pain is, and distraction and pleasure and all of these other things that the brain was processing whilst at work would actually eliminate the impact of pain, that overwhelming experience. But when she was on her own and left to her own thoughts, that's when her pain got worse. I think my complete lack of understanding about pain when I was with her, and then she took her life, and I was like, I don't know enough about this. So yeah, that's one of the major triggers.
Gosh. Oh, bless. I
Didn't
didn't.
expect that, did you?
I didn't. And yeah, it's not often I'm lost for words, but wow. Gosh, what a. That's yeah. I'm just. What a
But
like.
it then makes you realise what a responsibility we have. We have these
Yeah.
animals
Yeah.
in our community that we need to tune into their
We do.
experience. And it also, as sad as the story is, it gave me so much hope that there's so many more things that we can do. My understanding of pain was give them a non-steroidal, see them again in 3 weeks, and look where it's driven me. So yeah, it was a horrendous time, but also it's definitely carved a new direction.
Yeah, that's inspirational, and what a journey you've been on to where you are now. Would you say that what was the biggest gap you noticed in how arthritis was being misunderstood and mismanaged and stuff?
The biggest gap is people not seeing the signs, the early signs, but they're not really early. When you get it, and you go, that's late. But the change in gait, the change in behavior, these sorts of things are very visible. People say dogs hide pain. I'm not a big believer of that. I think we're not very good at actually picking up. Dogs have been domesticated for 33,000 years. Come on, are they still going to be hiding pain? Or could we argue that actually let's suggest that we're not very good at picking up on it before we assume that they're hiding it from us? But I think that's a big knowledge gap. I think that's a big awareness gap. There's still massive problems with diagnosis because our current approach is finding a pathology that explains the pain. But we definitely know in the human sector, there's a lot of primary pain conditions where there's no pathology to explain it. So there isn't arthritis, there isn't a vertebral anomaly, there isn't a splenic tumor, but people experience pain. I think we've got a huge unpacking to do there, and that's a huge growth sector. Then management, we have got quite a cool toolbox to manage chronic pain. It's still very what we'd call biomedical, so it's very much about drugs and tools and interventions, whereas we know from the human management of pain, it's very much about lifestyle. It's very much about your emotional state. It's very much about being active. So there's a lot still to be done, but the growth in the sector is huge. It's a lot of interest in it now, whereas there wasn't 15 years ago.
Brilliant. Let's start then with the basics, Hannah. What exactly is arthritis?
Again, so arthritis is a localized inflammatory condition of the joint, and there's different forms of arthritis. So you can have immune mediated, you can have septic, and you can have osteoarthritis. They're like the three biggies. What we're going to be talking about is osteoarthritis. So it's a localized inflammatory degenerative condition. It's extremely prevalent. So it's very prevalent in all species. They've even got evidence of arthritis in the dinosaurs. It's a disease that affects what's called articulating joints and moving joints. We tend to concentrate on the ones that are cartilage-laden joints. So we're talking knees, our hips, our wrists, our elbows, shoulders, etc. And it's a disease that is really associated with pain, because if you didn't actually have the pain of arthritis, it wouldn't be so much of a problem. Alongside the pain, you get restricted range of motion of the joint, so it changes the way that you function. But it's really the pain of arthritis, which is the big clinical sign.
Okay. Why is it much more common in dogs than many guardians actually realise?
So there's a number of reasons we believe. One goes back to awareness. I think there hasn't been the awareness is now very prevalent. We've got behaviourists that say, check it's not pain until before we assume it's
Yeah.
behavioural.
Yeah.
And we've got really big strides in awareness of how dogs and cats express pain. But we've also got, in dogs specifically, our choice of breeds. We've got a really big social drive towards breeds that don't necessarily have great innate health. So they are predisposed to conditions that lead to early onset arthritis, so hip dysplasia, elbow dysplasia, patellar luxation, osteochondrosis, ankle limb deformities. All of these are genetically influenced. So they tend to be passed down in lines and through breeds. Certain breeds are more common. And therefore our social choices are affecting prevalence. So there's a lot of reasons. Oh, and obesity. We've got a horrendous obesity epidemic. About 51% of the canine population are obese.
Oh my word.
And that's a huge driver of joint-related issues.
I just wanted to pick up on something because I've always sort of like, I don't know, in my train, but led to believe that a dog does mask pain. But did you say that they're not very good at hiding pain? It's the fact that we miss the subtle signs and we're not listening to them. Is that what you said?
So let's take out whether they're good or bad at it, and let's just look at it from the human angle. We've had them domesticated for years. So evolutionary wise, why would they want to hide pain from us? That just plant that little bit of seed. So it's not to their advantage to hide pain from us, their caregivers. I think that knowing what I know now, pain is actually really quite obvious when you take on board posture change, physical change, capability and gait changes and behavior changes. So I think for me, I feel it's more likely that we're not very good at detecting it. I think it's not that they're hiding it. I think that they're just getting on with it, which is a very different thing. Hiding is a conscious decision of, I must not give you any hint that I'm in pain because that will put me at a disadvantage. Coping and getting on with it is, I don't believe I've got a choice, so I'm just going to carry on navigating, living to the best of my ability. So I don't like the word hide. I don't really like the word cope because cope's got a positive intuition to it. It's got, oh, he coped really well with. Cope is actually both positive and negative, but in the human language, we tend to use it in a positive manner. So I tend to use the word of tolerate. Dogs tolerate pain because they don't know that there's an alternative and they're just trying to get on with living.
Yeah. I love that.
It's my opinion and I'm going to stick with it.
No, I think my mind's buzzing. Now, this is probably going to be dependent on the breed, but is there an age that arthritis can begin to develop in our canine companions?
Yeah, so arthritis has been always attached to a wear and tear condition. So it's generally been linked to aging. And that really shows in the figures. So we know that around about 50% of dogs aren't detected to have OA until they're around about 8 to 10 years old. So it has got that connotation because that's what we see in humans. Arthritis is much more wear and tear related. But in dogs, because the leading driver is developmental joint disease, so these are joints that aren't a perfect fit, arthritis is actually a disease of the young dog. So this is going to be dogs that are developing. So arthritis, you could be seeing it as young as 3, 4, 5 months old. It's not an old dog disease.
Oh, it's always just been like, I guess, like compared to older dogs, like, do you know what I mean? But like, I'm just thinking from a human perspective, like my great nan had it really bad and now my nan's got it. But then I know someone that's in his 30s that's got it. So yeah, it's not necessarily older dogs or older people.
No, not at all. And they did a study over at NC State, which is a university over in North Carolina. And it was a very simple study. All studies are expensive, so you got to remember this. Any study of this caliber is going to cost hundreds of thousands of dollars. But it was very simple in that they had the veterinary school use their primary care clinic, which was attached to the hospital, and they invited people of dogs that were aged between 8 months and 4 years old to come for free physical health assessment. So all they needed to do was be between 8 months and 4 years old. And they got 123 volunteered, and they would get a free physical assessment, including an orthopedic exam, followed by x-rays of every joint. So when you think about x-raying 2 views of every joint, that's a hell of a lot of x-rays per dog. So we're talking about wrist, elbows, shoulder, hips, stifles, hocks, 2 views of each, times that by 123. So that's why it was still quite an expensive study. And what they wanted to look at is what percentage of those dogs actually had radiographic signs of early onset arthritis, and how many of them also had pain associated. Because you can have radiographic signs of arthritis and no pain, and you can have pain with no radiographic signs. And what they found is that of that cohort, 40% already had radiographic signs in at least one joint, so 8 months to 4 years old, and 24% of them had pain associated with a radiographically affected joint. So yeah, it's a much bigger problem than people realise.
I am one of the staffies that I walk. He's been diagnosed with it in his elbows, but he's gone to like a OA specialist, like a specialist vet, and they said that he had to lose weight first before they would look to do treatment and stuff, because he was a big old bulky boy.
Yeah, and this is the thing, is that there's so much that we can do. That's it. And then probably the biggest thing that we can do is keeping our dogs lean from puppyhood throughout life. And it's very socially awkward, because like you've just done, don't take offense, but you're like, oh, he was just chubby, and there's the little smile and you make light of it, but actually you're killing them with kindness.
I know.
And all of us, and this is what I mean, this interdisciplinary team, it doesn't matter if you're a pet shop owner or a vet or a dog walker, it's not funny anymore. It's not funny. And if we all work together to say, your dog's carrying a bit too much weight, the taboo goes, and it's not socially awkward, and people don't get defensive and start assuming you're fat shaming, because we know that the health concerns that come from being overweight are insane. It's not just joints we're talking about. There are other physical health, immune health, cardiovascular health, endocrine health, psycho health. We know that dogs that carry weight have a more pessimistic outlook on life. You know, it's really weird that we've got so much data, but we're not making any headway. It's getting worse. It's getting worse. And then you walk into a pet shop. Oh, all the pet shop owners that listen to your podcast are now going to hate me, but I'm not bothered, because it needs to be said. You go into a pet shop and it's just nothing but treats and high fats and inappropriate. And what are we doing? Come on, guys. You know, what you should be doing is going in and immediately being hit with a body condition score chart. Where are you at, and how can we help you get to where you need to be? Not sausages and all of their stuff. Drives me mad, because we say that we love them, but we're making the biggest hiccup from day one.
Yeah, because if you'd loved them, you wouldn't give them all the crap, would you? You'd want them to be healthy, because it's going to prolong their life.
Yeah, absolutely. And we've got strong data to support that. We're not just talking a couple of weeks or a couple of months. We're talking 2 years.
Yeah.
You know, so they did a study there. They were looking at like about 40,000 dogs. It was a big study. And specifically in Dachshunds, if they were kept at a lean body weight, they lived like 2.5 years longer.
Wow. And in a dog's life, that's a long time, really.
Like, I hope that I'll make it to maybe 80. So that's like another 20 years. That's crazy, isn't it?
Yeah. Oh. Right. The early signs that us guardians then, or those guardians listening or watching, might often miss. So are there some subtle signs of arthritis that might be overlooked by guardians?
Yeah, I think this is where the behaviour world is really taking hold, and this is great. So we've got to start looking at what are expected kind of behaviours that you can logically link. And the big one is fear and anxiety, isn't it? If you are experiencing pain tells you something's wrong. You need to have an emotional response that's quite a motivating emotional response that is going to drive you to do something about your pain. So it's going to be a strong emotion. So fear is a very strong emotion. So looking at those kind of like behavioral changes would be a really good place to start. But many behaviors, like I'm learning from my behavior friends of like resource guarding. And I was like, how does that work? How do we explain that? Obviously, we've got our aversive behaviors of don't pick me up like that, don't touch me like that, don't ask me to do that. But I never really thought about appeasement. Please don't touch me. Oh, what are you doing? Oh, I'll come up to you and you tell me what to do, but don't touch me there. I learned a lot from my behavior friends, like, because I'm not trained in that at all. So going back to your point, I think behavior, changes in behavior. We've got some behaviors that are really strongly associated, the fears, the anxieties, the aversion. But there are other behaviors that you go, how does that stack up? But something has changed and it's not right. So what's underpinning? What medical complaint could be underpinning that change? Postural changes, I think we're all waiting for a limp. We're waiting for that really overt lameness. But it could be that they're beginning to sit differently. They're beginning to lay differently. They're slower and more thoughtful in transitioning from a lay to a stand. They're hesitant. So not that they can't do the stairs, they might think before they do the stairs, or they might reposition before they get on the couch. So there's loads and loads of stuff that we could be using to identify signs earlier.
Yeah. And I only realised recently, or learned recently, that when a dog goes to go for a poo and they squat, if they move around a lot, that could be a signal or a sign that they could be in pain if they're not staying in one spot and they're moving.
Yeah. Yeah. So quite often you can't put anything as it's definitely pain. So that could be, itchy bum hole. It could be that he's got really stiff stools and he's really struggling to pass. But if you had a dog that always toileted in one place, but now they were doing what's called the poo-poo train, so they seem to like trip a bit, move a bit, drop a bit. If they looked like the ears were back and they looked like they were having a difficult time, and you had other things associated with it, so some physical changes, the way that they squatted was a different posture, they were very front end leaning. You go, there's something going on here. And then we would like to think that you can go to the vet and get their opinion, that you can get a full clinical assessment and see what's going on.
That you referred it to as a poo-poo train. I've not heard of that one before.
Well, no, the poo-poo training. Oh, yeah.
So could behavioural changes be linked in pain? So, for example, reluctance to go for a walk, changes in mood, or difficulty settling, could that be related to arthritis?
Oh, yeah, for sure. And when I started my journey, and I'm still very much at the beginning of my learning, I hung out, and I still am friends with Gwen Covey-Crump, who's a most beautiful soul. And I can remember listening to her and reading her articles, and she was always pushing this concept of if you see an unexpected change, check if there's something underpinning it. And that could be a physical change, that could be a behavior change, that could be a capability change, but check. Now, this is where it gets difficult because with age comes change anyway. You are always changing, influenced by the environment. If you move house, you're going to change. If you go to a new doggy daycare, you're going to change. So unpicking whether that change is medically relevant is really difficult. And that's why it's a bit like detective work. You get a little bit of information from this. You got the personality change. You got some physical change. You got some capability change. Oh, actually, now I've got enough that I need to check whether there's something else underpinning this. So yeah, it's hard. Chronic pain work is very, very difficult. So lots reliant on communication and building a good rapport with your client, because that information is then how you work out whether your intervention is working. So spending time working out what the subtle signs that suggest they're in pain are, hang on to them, because they're what you're going to use to see whether your choice of intervention is working.
Yeah, brilliant. Are there any myths around arthritis that you'd love to clear up once and for all?
Well, we've tackled one of them about it being an old dog disease. It's not. So please, guys, don't just look at a 3-year-old dog and say, well, it can't be anything to do with his joints. The floor is open there. Joints need to be considered in all stages of a dog's life. I don't know. Are there any real myths? Well, there's so many. It's like he'd tell me if it hurts.
Oh God.
Well,
Yeah.
if you're looking for him to go, hi, up, or I'm not going to eat my dinner, or I'm going to, they do tell us that it hurts, but we have to go and look for it. I think that's another one. There's a strong push towards using non-pharmaceuticals early because they want to save it for later. I think that's a real problem. I think we need to build a greater rapport between all disciplines to say, well, when you've got pain, the most important thing is to get rid of the pain. And let's use whatever means is possible to reduce that pain as quickly as possible. Be that pharmaceutical, be that surgery, be that rehab, be that nutrition. But there's a lot of people going, well, I don't want to use meds until I really have to. And you're like,
Yeah.
for whose benefit? Pain is
Mm.
pain. That's the lived experience. God, there's so many, Nathan. I could be here all afternoon.
That's fine. Right, let's move on to the emotional impact on our lovely doggies. So, living with pain can affect how a dog experiences the world, but how does it then influence their behaviour and well-being?
So let's think about what pain is, and then I think it unpacks itself. So pain is a emotional and like physical, physiological experience. So it's called the pain phenomenon because you have an emotional interpretation, you have a cognitive interpretation, but you also have a physical and physical stress response, physiological and physical. So pain is a really massive impact on your body and brain. And pain is generally linked to there being something wrong. So pain is a messenger. So pain is actually a good guy because it's telling you that something's not right and you need to do something about it. And it's a very loud messenger because he's trying to tell us something really is not right and I need you to do something about it. So pain actually keeps you from harm. It helps you protect yourself to heal. And it means that you learn from it so you don't do whatever endangered you again. So
Mhm.
it's a massive evolutionary advantage to have pain. If you don't have pain, you're likely to not survive. You won't know when something's not working in your body. You won't know when you've traumatized yourself.
Mhm.
You won't know when you've suddenly got a septic wound. So therefore, you're not likely to survive. So pain is really important.
Mm.
But uncontrolled pain is the problem, isn't it? Pain as an alert signal is really important, but having pain that is persistent in nature no longer serves purpose is potentially amplifying. That's a real problem. So when you think about pain being this loud messenger, we've got to think about what kind of impact is that going to have? Well, it's going to have a great emotional impact, isn't it? Because it's really telling you to do something, and that's going to lead to being quite wound up, quite highly aroused, quite vulnerable, but anxious, but stressed and fearful, defensive. So all of those kind of emotional states make sense when you think about what pain is. Now imagine living in those emotional states, always being defensive, always feeling vulnerable, always being fearful. That's not a person I want to be. And I've tried it. I did a social experiment on myself. I sat in a car and a couple of my friends had been diagnosed with anxiety. And I was like, what's this about then? So I decided to drive for 20 minutes and imagine the worst case scenario as I was driving down a motorway. Oh, that car's going to hit me. Oh, God, they're going to suddenly brake. Oh, because something's going to run in front of me. And I was like, I don't want to live like this. This is horrendous. And therefore, I think I have a quite a good way of making myself feel what it must be like to live with pain, always being alert, aroused, vulnerable, defensive, fearful. So that's like the emotional impact that can come with living with pain.
Yeah, so you mentioned like anxiety. So would you say that chronic pain can contribute to anxiety and then
But
reactivity?
yeah. So my behaviour friends and my clinical behaviour friends would be able to talk about the pathways and the limbic system and the amygdala and all. Bring Daniel Shaw in because
Oh,
he'll be able to fill the gaps.
yeah, he's been on.
Yeah,
Yeah, yeah.
yeah. I can't do that. I look at it and I go, try and remember it. I can't remember it. But yes, they're highly associated.
Yeah, Dan's been on and I spoke to, we had Jess Hyams on the other day, I know. You know, well
Oh,
as well.
she's a good friend. Yeah.
Yeah.
I was terrified of her at first. I was absolutely terrified. But we're quite good friends now.
I know, she said she loves you. Yeah, brilliant. I love it. Right. So, why is understanding pain so important for behaviour professionals as well as guardians?
Because pain is a really good indicator that there's something wrong. So that's our opportunity to identify these cases and then be able to make their life a life worth living. But also by modulating their emotions and their experiences, we can influence their pain. So we know, for example, let me give you a good example. I'm driving to work and it is raining and my car breaks down. And as I walk into work, I stub my toe. My pain experience is probably going to be quite. But if I'm driving to work, the sun's down, I've got a really great roofless car, whatever they're called. I stub off and I get a lottery ticket and I win 250,000 and I walk in and I stub my toe. Probably not going to be that bothered. So our pain experience is very much affected by our emotional state at that time. So if we can work on improving the emotional state, we can influence the pain. So they're really highly interconnected.
Yeah, brilliant. Love that. So, supporting these lovely dogs with arthritis, if it's been identified that they've got it, where should guardians begin?
So it is tricky. In an ideal world, we would like the following flow diagram to happen. So the caregiver, the guardian, believes that there's something wrong. Then they take that information in a very, very easily interpretable manner to the vet, who's got 15 minutes, back-to-back consults, really busy practice. And they go, oh, right, so you've noticed that your dog's behaviour's changed. They've become quite aversive to being handled. You've seen that they've got quite an arched back. You've seen them lame a couple of times. Right, I hear what you're saying. I'm going to go and have a look. So first part of the journey doesn't always work. Then you've got to have a practitioner that, dare I say, has got the capacity at that time to pick up on what can be a bit more subtle. Then what would be ideal is that we pursue a diagnosis to the best of our ability. So if there was a suspicion that there was, say, painful hips, it would be lovely to take the next step of doing a sedation, x-rays, confirm findings, etc. And then from there, it'd be lovely for the vet to say, this is what's called a multimodal approach. So your dog needs to trim down. Here's an anti-inflammatory. Here's omega-3 supplement. And I'd like you to see my colleague who's a physiotherapist for some functional work to try and improve resilience, functional capacity. Brilliant. We're all connected. We're all going to keep working together. Your aversive behaviour that you've been seeing, pop in and see my behaviour friend. They'll give you some tips of how we can actually make sure that the dog extinguishes those associations and starts with a more positive mindset. That's what we'd love to happen. Unfortunately, it doesn't. And there's many, many stumbling blocks. Quite often a caregiver will come to the vet and go, something wrong. Yeah, okay. Yeah, it's just something not right. You're like, okay,
Or,
where do I start?
or they say they're just lame. Lame gets thrown around, doesn't it?
Yeah, lameness gets thrown around a lot. And I think what I'm trying to get across is please collect.
Data, yeah.
So, because say you went in and said, my dog's intermittently lame, but when you walk in, that dog's not lame at all. It's bright as a button because it's highly aroused. And that vet's going, right, ideally, we should do x-rays, but that's going to be about 600-700 quid. And ideally, I should put this dog on an anti-inflammatory. That's going to be 80 to 120 pounds a month. And it could cause a bit of diarrhea. They're not convinced that their dog's in pain. I can't see that their dog's in pain. I don't want to do that because I'm going to destabilize my relationship with that caregiver. Because if they don't really believe there's a problem and that dog then gets a little bit of diarrhea and they've paid 150 quid to get, they're not going to like me. So that's just one mini scenario of many things that are happening in a vet's brain in the context of that 15-minute small room kind of experience. So go with good information.
Definitely. Are there any simple changes that guardians can make at home to help their dog feel more comfortable?
Yeah, I'm known for more rugs, less drugs. So I'm just when you
More,
see it,
More rugs,
More
less drugs.
rugs. It started years ago when I was doing my mobile service and I was going to people's houses and their dogs were physically debilitated. And I was thinking, they can't walk across that floor. Can't you see that their ears go back? They tense up, they stiff, they don't want to go there, they slip. And I was like, this seems crazy. Why aren't we seeing this? So it first started off for dogs that were debilitated, but now I'm across the board, even if they haven't got musculoskeletal health problems, if they're spending 95% of their life in a house with slippery floors and they run to the front door of the postman and they slap, if they run into the kitchen for feeding time, they slap, I'm thinking, how many soft tissue injuries are we seeing that are actually occurring in the home environment? So for me, I just have a really big thing about flooring. They're not designed for pets. They're designed for us to keep them clean. It's not in the animal's interest. They prefer carpet.
Yeah. Yeah. Nice, comfy carpet or rug.
Yeah, they just want grip. They want traction.
Yeah.
Yeah.
Yeah. You wouldn't want to walk across a hard floor all the time, would you? Maybe. So why should they?
Well, dogs' feet aren't designed. They're designed for external terrain. So
Mhm.
the pads aren't offering any grip. They become hyperkeratinized and shiny. The claws can't engage with a hard floor. We've
Mhm.
now got breeds that have lots and lots of fur between the pads that quite often overlie the pad.
Mhm.
So when you actually really look at dogs' feet, they're not like cats. Cats have a little bit more of stick. The pads are different.
Mm.
So dogs aren't designed to engage with the terrain in the house that we put them on.
Mm. Yeah. Well, and just obviously, like from our perspective, we it's probably like a cosmetic thing, isn't it? But we need to be setting them up for success. So
Exactly.
more rugs. Exercise, movement, and lifestyle. So many guardians worry about exercise and dogs with arthritis, but how should movement be approached, Hannah?
So we know that mobility is absolutely essential for life. So all of our physiological systems rely on movement. Our cardiovascular and lymphatic system, our gastrointestinal system, we're designed to move. And many of the health concerns that we have, even psychological, are related to sedentary behavior. So we know movement is really, really important. And movement in ill health is equally important. It just has to be modulated to our capacity. So with these dogs that have arthritis, bear in mind you can have very mildly affected and they're still doing flyball. And you can have them very, very severely affected and they can hardly stand. So arthritis is a big spectrum. But keeping them moving to the best of our ability is really, really important. The way that I tend to advise clients is a little bit different. And sometimes it's a bit too much for people. But I'm a strong believer that I give my clients the tools to make the right decisions.
Mm.
So I talk about being proactive, reactive, and reflective. Little and often is a bit too vague because people don't know what that means. But
Okay.
what I mean by the PRR means look at your dog and think about what can they safely do. So proactively think about what would be the right exercise, the right duration, frequency, terrain, activity. Are they in a good position to do that safely? Then when you're doing your exercise, you might have got it wrong. They might be having a bad day. So reactively look at what they're saying to you. So if they're slowing down, if their tail drops, if their ears go back, if they start lagging behind, that's time to go home.
Mm.
You know, you're risking making them more painful. Their tissues are fatiguing. And then be reflective. When you're at home, go, oh, do you know what? Today we did only 20 minutes. Normally we do 30. Okay, for the next few days, we're going to stick to 20. Let's see if he perks up out of this. So we need to put away our phones. We need to walk our dogs and be with our dogs. That's why we do it, isn't it? That's why we have dogs, is to have their companionship.
Yeah.
So we need to be thinking, what are we going to do today? How are you coping with today? Did you enjoy today? And then using that information to carve out that exercise plan that suits them.
Brilliant. Yeah. And is there any types of activity exercise that are helpful? So I'm assuming like physio, hydro.
Yeah, they're definitely helpful, but I do also know that we're in an economic crisis. Many people have pets and can't afford those type of interventions. Doesn't mean that you still can't do amazing stuff with your dogs. So we're looking at low impacts, less torsional forces. So what we mean by that is, think of a joint. If you're coming down from a high up area, down, that's effectively what's happening in that joint. That's going to aggravate it. Or twisting, that's going to really aggravate the joint. But you've got to think about all the tissues around the joint as well. So joint doesn't sit on its own. It's got the joint capsule, it's got ligaments, it's got muscles that bridge over the joint. All of them are going to be affected by these high impact, high torsional forces. So trying to veer away from that kind of activity and doing more kind movements and pushing on functional movements and bending, stretching, different terrain, what we call different proprioceptive inputs, so different challenges that are safe, looking at trying to improve on their resilience, so the amount that they can do. So I'd be steering clear of ball throwing. But if your dog's a ball loving dog, I would take the ball because it gives them pleasure, and I'd hide it and ask them to go find it. So that sort of thing.
Ball throwers, they're a bit of a contentious issue, aren't they?
I'm kind of hate now because I'm outlandish enough to say that I think it's inappropriate. For me, it's no different to putting heroin for sale for kids. We know that dogs have an extremely compulsive type demeanor. I've got a border collie. She would run to death to chase balls. She would just has no off switch. If you get a ball out, I'd lose her. Her eyes just go,
Someone just takes over him.
just gone. And I don't think we realise how powerful that is. Now, there's many people that use it very successfully sporting and for working dogs. And I'm not saying don't if that's your thing, but be mindful that when they're like that, they're going to push past physical capacity. And if they're not physically capable of doing that kind of activity, they could push themselves over. And I've got a problem with it with young dogs, I've got a problem with old dogs, because I don't think people realise what a weapon it is. It's not a bad thing if you know what you're doing.
Yeah.
I don't think that it's marketed with people realising how damaging they can be.
And it's that repetitiveness, isn't it, as well? And that impact it can have on like the joints.
Oh yeah. And it's also the fact that humans are getting lazier. We're going to the park, we're getting out the pool jogger. We don't want to do the activity. We don't even want to bend down anymore.
Well,
we want to use a chucker to pick it up the floor.
What you
we're going to
see is they've just sat there and it's on repeat. Sat there on a chair, and there's this ball throw, and the dog's just going bloody nuts back and forth.
Yeah. And then I feel bad because there's going to be people that are going to be triggered by that. But just before getting defensive, before lashing, just take a time to think about it. I used to throw balls. I used to throw balls all the time until I really thought about it and thought, oh, crikey. And I contributed to my dog, Holly, the flagship of Cam. I contributed to her ill health because I didn't know better. But when you think about it, you're like, God, it makes a lot of sense. And like one person said to me years ago, you have a dog to be your companion. Why would you keep making it run far away from you? And I was like, that's a very good point.
Is there anything other than ball throws that guardians should avoid at all?
Difficult. It's really difficult because it really is on the guardian and what you're doing with the dog and whether you're doing it safely. I think my biggest thing is take time to think about what you're doing and does it make sense for your dog and your dog's capacity. Because anything being done inappropriately and repetitively could be harmful. But let's go back to weights. Let's just make this one about weights. Seriously, guys, you put your hands in for those treats, look at your dog, look at their waistline. Have they got a rib cage? Do they need it? Are you doing it for them or are you doing it for yourself?
Definitely. Hannah, we've literally sailed through this episode. It's been amazing. So we're going to spend the next 5 minutes just wrapping up with some final questions and thoughts. So Cam and helping these dog guardians. Can you tell us more about the work that Cam does to support both guardians and professionals?
Yeah, so Cam didn't have a plan. Cam was Hannah just angry and started something in 2013, and I've been trying to shape it into a peripatetic support service for the last, it's 11 years, 12 years now, 13 years, even worse. Cam is designed to support caregivers, the canine professional world, and the veterinary professional world, because chronic pain is way more complex than we give it credit. It is not a pill and see you in 3 months. It's not just hydrotherapy. It's not just weight loss. Chronic pain management is complex. And I wanted to create a place where people could lap up that information in a really empathetic, practical manner. So I'm hoping that we've now got a website, which we're rebuilding, that you could go to and get what you need, or you can at least start your journey. So I would love caregivers to go look. I would love canine and veterinary professionals to use the resources and encourage their clients to go to their website. We have a member zone, so we can actually really put more into it now. And we are financially independent. So what I say is not affected by a drug company sponsoring me. So that's really important to us, that we remain independent. So therefore we do need an income. So it's £35 for the year to join CAM, which is half the cost of seeing a vet for 15 minutes.
Yeah.
So we do lots and lots. So I had Professor Alex German in the member zone only 2 nights ago. He's world-class speaker about obesity management, with all of these really high-end speakers that you're not going to have access to elsewhere. And it's for a mere £35 for the year. But we do lots of conferences. So we've got the Chronic Pain Symposium coming up in April the 24th to 26th. It is truly interdisciplinary. So it's for canine professionals and veterinary professionals so that we can learn together. So we do that. We do lots of conferences. We do practice trainings. We do rehab clinic trainings. We've got courses in our education centre for vets, nurses, canine professionals and caregivers. So if you want to go and learn more, maybe you're a dog walker and you're like, I need to learn more, please go and do CAM Advocate Level 2. You might be a vet nurse that's got quite a good understanding, but you want more, go do CAM Veterinary Practitioner. There's lots and lots out there. We've got a shop, CAM Online Shop, but my little passion project at the moment is the Pain Vet. So it's a subsidiary of CAM, because over the last 13 years, I've had so many people approach me for advice, and I've been very constrained because I'm not their vet. There's a rule, you're under your vet's care. So having got loads of messages and emails and having done it for 13 years, I approached the Royal Vet College and said, can I set up a online service where I could be a peripatetic to that person's vet, so that I could do a lot of the legwork for that vet, but the vet retains charge of the case. So they'll do the x-rays, they'll sell the drugs, they'll sell the prescription food. So we've been working, me, James Hunt, Katie Smithers and Evie Tooman. It's called The Pain Vet. It's thepainvet.co.uk. And it's a way that if you've got a case that needs more time, you've got a case that you can't get to the bottom of, you've got a case where the vet doesn't think it's pain, but you think it is. There's so many reasons to use the service. And the way it works is you book an appointment. You can see Evie for 10 minutes for free. She's a nurse. She's amazing. She does the discovery course. Or you can see Katie, James or me. We all have our passion in pain management. You send in photos and videos. You fill in a questionnaire, quite extensive. You finish in a pain questionnaire. We get your veterinary history. We go through all of that. It takes probably about 2 hours to go through all of your info. And then we have an hour online with you, talking about your case, coming up with a management plan, and we create a report that goes to you and your vet. So we really set you up for success. And that's been something that I've been working on for a while. And I think people are quite cautious about it. They're not really sure how it works. But the amount of inquiries and the amount of movement on Holly's Army, our community group, how much movement there's on CAM or social media, I know it's needed. It's just trying to get people to change their social habits. Most people just go, oh, well, I'll just go and see my vet. but then they'll come back online going, my vet didn't do anything to help me out.
Yeah.
There's another. But yeah, I'm hoping that I'm working towards creating a project that really supports my profession, continues to grow the chronic pain sector, because I'm learning loads and I want to teach it. And I feel that we're hopefully bridging a gap for dog trainers and behaviourists that have cases that they think have pain involved, but the vet and them not really maybe gelling.
Tricky, isn't it,
and
sometimes?
Exactly. And then for caregivers that want more than 15 minutes.
Right.
So there's lots going on.
No, that's amazing. So I'll put that link in the show notes. But how can people get in touch with you, or if they want to know more about Cam?
So if you want to know more about Cam, go to caninearthritis.co.uk. And you now can be channeled into being a caregiver.
I saw that.
Yeah. So behind the scenes, we're rebuilding the websites again. So at the moment, the front end is perfect. All the resources are great. But the actual owner website, I'm rewriting. That's going to be the third time. We're rebuilding the member zone as well. So you can access the member zone via that website, and you can access all of our social media, our shop. You can even donate via that website if you quite like. But that would be where, and if you want to get hold of me, hello@caninearthritis.co.uk.
I'll put all the bits in the show notes. But what message, as we wrap up, would you love every dog guardian to take away about arthritis, Hannah?
Please attend to it early. I think the thing that breaks my heart is that dogs are so bloody lovely. They put up with so much. And I see the cases they come in and they're really quite debilitated. And you think to yourself, you've been living with pain for a few years now, and you've been picked up and put in the back of the car, and you've been walked and you've overdone it. And all of these times that we haven't recognised that you're really sore. And I don't know, have you ever got delayed onset muscle soreness? Have you ever been to the gym and you've overdone it and you're like, oh my God.
I've been to the gym for a long time. I do. I've done yoga in my time. I love yoga.
Yeah. Have you ever done it when 2 days later you can't move? You're so sore.
Yeah.
And how would it make you feel to think that your dog was going through that indefinitely and no one heard them?
Awful. Absolutely awful. Yeah. I'd want to advocate for them. Make it all better.
Exactly. So please, caregivers, if you're in fear of going to the vet, you're in fear of what they're saying, you're in fear of bills, you're in fear of medication, whatever it is you're in fear of, your dog's not. Your dog's living the experience. And it's your duty of care to go and get them the attention that they need.
Love that. Thank you so much. Hannah Capon, thank you so much for joining me on the Yappy Hour, powered by Yappily. I've absolutely loved chatting with you today.
Thank you for having me.
You're most welcome. Before we finish, here are a few key takeaways from today's conversation with Hannah. Number 1, arthritis is extremely common in dogs and can begin much earlier than people expect. Number 2, early signs are often subtle. Changes in behaviour, movement, or mood can all be indicators. Number 3, pain can influence behaviour, which means recognising it is crucial for both guardians and professionals. Number 4, arthritis management is rarely about one single solution. It's about a multi-module approach, including vet care, lifestyle adjustments, and supportive therapies. And number 5, most importantly, with the right support, dogs with arthritis can still live happy, active, and comfortable lives. A huge thank you to Hannah Capon and the team at Canine Arthritis Management for joining me today and for sharing such valuable insight. Thank you so much for listening to the Yappy Hour powered by Yappily. If you found this episode helpful, please consider sharing it with a fellow dog guardian, because understanding our dogs better helps us support them throughout every stage of their lives. And I'll see you next time on the Yappy Hour.